want to do, again, is you're asking for active range. Make sure your towel is not too big. This is a little big for Joanne. You want it just to be that the humerus is parallel, right, going toward the glenoid. You don't want it to be propped up too much, okay? So you want it so that your arm is nice and parallel, because if there's no towel, now she's actually facing like that, going down toward the floor, all right? So it does make a little bit of a difference with your measurements. So make sure that she's projecting straight through to the glenohumeral joint, to the head of the humerus. You ask for her active range of motion first, right? And then you can slide a little bit toward me, actually. Good. Good. Okay. And when you do this motion, a lot of people have some apprehension in external rotation. A lot of people have excess motion there. So just do it gently when you do your end feel here. Don't really do an excessive end feel, because this is really the position that a lot of people dislocate their shoulder in or have a lot of subluxations. So just be gentle. Watch your patient's face. If they're telling you they feel apprehensive, don't go ahead and push it. An empty end feel is pain, right, guys? So if somebody's apprehensive or has pain, that's end feel. You don't have to just crank on them to feel capsular end feel. End feel could be them stopping you from pain or apprehension as well. So you ask for her active motion first, and that's the reason why, because you see where she's comfortable to go, and you can see, test the little end feel to make sure she got all the way. And your landmarks are going to be at the olecranon process, projecting through the humerus to the humeral head, right? That's your axis of rotation. And your moving arm is going to be toward the ulnar styloid process, right? Your stationary arm is going to be parallel to the trunk. Now when you do this, when you're doing active range of motion, you need to when you're doing passive range of motion, you need to stabilize the humerus well, so that there's no compensations at the thorax and the shoulder. For external, it's not going to be as much. You could see some extension of the thoracic spine, right, or some elevation of the shoulder joint, but it's not as common as when you do internal. But we'll do external first. Okay, so you're going to measure there. The hand that you're holding the goniometer with, you can stabilize the humerus with. So you bring it back, and I'm just going to switch my stationary arm to go the other way, and I'm going to stabilize like that as I hold my goni, and I can move my moving arm and do my end feel from here, and I see that she gets to full range of motion. And for this one too, I don't think we go excess motion as well, do we? We just do 90. So AAOS says 90 degrees is your normal range of motion, right? So you don't have to go past that in order to test your end feel. You test your end feel, make sure they got to 90, and you'll tell us that they achieve full range of motion of 90 degrees of shoulder external rotation. So what a lot of people forget to do is stabilize the humerus, and they just kind of hold it. For external, you won't see as much of a problem, but for internal, when you go to do it, and they're internally rotating, look at Joanne's shoulder, right? She flexes her thoracic spine, she hikes her shoulder off the table. That's a big compensation. That's a lot of scapulothoracic joint motion. You don't want that to occur. So when you do your active range of motion, you let her move, you block it well, you see where her end range is, because you can feel end feel, and you can start to see that little compensation. Just remember, just like in the hip, there's going to be a little bit of soft tissue approximation. So as soon as you see that, doesn't mean that she's compensating. You want to go all the way, feel the end feel of motion, and that's when she's going to compensate, okay? So that's why you need to stabilize well. So as you do it, you're going to have one arm stabilizing the humerus like that. You can use your other arm to move your goni. So you're going to hold on to it like this if you can. And then passive range, you're stabilizing well. You get to end feel, you see that shoulder start to move. But I know from my active range assessment that this is roughly where she ended up, right? I adjust my axes. I adjust my axis, and I test my end feel again, and I know from my norms that I've gotten close to or the same of normal range of motion, right? Makes sense? If you're seeing this on the practical, that's scapulothoracic motion, all right? Does that make sense? Any questions on that? Thank you, Bill. Please raise your hand. Can you speak? Does anybody have any questions? You don't want any excess motion for the shoulder, right? You don't want any extra range of motion for the shoulder, right? Just exactly as.
I'll just throw in from the last practical, the one thing that you guys failed to do is before you take that final measurement, just double check everything. Make sure you have your axis of rotation, make sure your stationary arm is parallel or perpendicular, wherever it's supposed to be, and then double check your moving arm.
Any questions on any of the